So I am at the Titanic Hotel. I've just had a sit down with podiatrists Gareth McMullan, Claire Dobie and Sean Savage. And we're talking about their new really exciting initiative, which is on diagnostic ultrasound education in the island of Ireland. So we're at the amazing Titanic Hotel that you can see behind me, as well as there we've got the actual Titanic Museum. So absolutely spectacular venue, really exciting course. It's quite loud in the hotel, so hopefully it works out. But yeah, let us know what you think. Cheers, guys. Guys, it's amazing to be here. Like, we're in the Titanic Hotel. You can actually see Harland and Wolff outside. What are they called? You mentioned it before.
Samson and Goliath.
Samson and Goliath. So I absolutely love coming to Belfast every time I come here. Always got that buzz about it. And even more so today. So it's really exciting, the project that you guys are working on. I think it was you and I spoke about it first, Gareth.
Yeah, certainly. Just trying to put the idea together and putting the feelers out for getting some ultrasound companies to come on board with us and get involved supplying the machines for the events. So certainly exciting.
Yeah, so in terms of like the main drive, like education, we're really passionate about education. Sean, you and I have talked about education and ultrasound, and everyone speaks very highly about what you're doing. So where does this come from? What's the vision for you for ultrasound in Ireland?
Well, myself, Claire and Gareth were, I think, not 100%, but I think we were the first three pods in the island of Ireland to get qualified in ultrasound and case accredited. So, I mean, we have done various CPD events in the past to Northern Ireland and again to the south of Ireland, but CPD's pretty redundant over here. It's pretty poor. A lot of the CPD you'd have to go across to the mainland. So we decided, why don't we do it here? You know, we've got expertise here. We've got some fabulous guys, physios, docs, pods. We can do this ourselves here. So that was really one of the reasons. So we've got together, got a great team together. We think probably we've got sports med doc who is of the highest class, two physiotherapists who are working in elite sport, Marty who is working with elite Gaelic teams, and Gareth, fabulous practitioner, great, knowledgeable, Claire the same. And I just come in to make the tea, really, actually. But it's good, and we've got great energy, and everyone's got great ideas, and it's just putting it together, and it's starting to work, which is amazing. It looks really good for the future.
Yeah, that's really good. Like, how has this team come together?
I think it's just kind of came together really organically. Myself, Gareth, and Sean, as Sean said, used to do some CPD. Together, and we've trained together in the ultrasound and we've supported each other through that. The team is really made up of the trusted professionals that we refer our patients to and have developed really good solid relationships with over the last 20-25 years. So it's really a team that we trust and know well, and we know that they're respected within each of their professions, and I think it's just testament to all of our skill sets that we do work daily within a multidisciplinary team with good quality clinicians, and it really was very organic, and we all share the same principles of education, principles and goals, and really the mission statement of what we want to achieve just sits really well with each of us. So when we came together, we all had the same vision and the same hope and excitement about trying to get things sorted. So it was just totally organic.
Yeah, no, it's great. I mean, it definitely comes across. We've just had some food this evening and talking about what you're trying to do. But like Gareth, I think what excites me is that we see a lot of education that's out there. Ultrasound is massively growing, but it's also like how it fits into everyday clinical practice. So like how will these courses and these events that you're doing, how will that fit for people that come on them?
So, I mean, going back 5 or 6 years ago when I first started getting into ultrasound, I wasn't sure if the money involved in the training and buying an ultrasound machine would be of much benefit. The heavy MSK caseload, I thought, do I need it, do I not? I did a few introduction courses and I started to really understand pathology better, where yes, you can assess and start treating a patient for the pathology you think they have, but when you have the image in there, you confirm your diagnosis there and then, so you don't maybe waste 3 or 4 weeks of rehabbing something that's wrong. You know, you're really helping to nail on your diagnosis at that initial assessment and confirm your suspicion. So moving that forward really in podiatry world, we're seeing a lot of very intricate detail around foot and ankle. We can rule in and rule out a lot of things, reduce the amount of MRIs initially that we're having to go for, which is great for the patients. But then rolling it out to all professions is brilliant, because you've got the world of physio, you've got osteopaths, you've got your GPs, your sports med docs. It's becoming so popular to have that point of care ultrasound there, and with MSK caseloads, it's
actually,
brilliant.
Sorry, I think it's expected too. I think patients are now expecting to have a point of care diagnostic available to them. They're seeing it on Instagram, they're seeing it in social media, they're seeing what other practitioners have up the road. So I think it's really important to upskill your profession, to upskill your clinic, and to bring that expertise in. And like, definitely if we can do it,
Yeah.
it's achievable. You know, like, we all have busy schedules and work life and family, and I think it has completely revolutionised how I run clinic. It's completely, I feel it's given me a little bit of longevity to clinic, and you know, it's definitely added value and changed how I thought about pathology. And coming from an orthopaedic podiatry background, you know, I thought I had heel pain pretty well down, and it does change, you know, how you look and how you diagnose.
It completely changes.
100%.
Yeah. Completely takes the guesswork out of it.
Yeah.
And it's not only that. So once, Gareth mentioned quite a sort of poignant point. Once you get over the trauma of the cost, the time, the cost again, the time again, the away from your family. Did I mention cost? So once you get over that initial trauma, and then you make the decision you got to do it. I mean, it's probably the best course, and probably the most productive course I've ever done. I thought I was good at anatomy. I thought I was good at clinical tests. I thought I knew my functional anatomy until I started to do ultrasound, and I realised I knew nothing. So it's completely changed us as practitioners. Our functional anatomy now is second to none. We're extremely good at it. It makes you a better practitioner. You know, Claire mentioned about heel pain. You know, there's so many variations which you see in ultrasound that heel pain could be. So it helps the practitioner. One of the things that I think really helps too is benchmarking how your treatment's coming on.
Yeah.
You know, if you see a plantar fascia, you measure it and it's 8-9 mil, you give your patient your treatment regime, your shock wave, your loading, your orthoses. Patient comes back in, you can review, see how things are getting better. You know, the patient sees that, and it can help immensely.
And the compliance has gone
And
up. I've definitely
compliance,
seen
absolutely.
that, you know, when people can
Yeah.
visually see those measurements change for the better, then their compliance, they're on board with the treatment plan, they trust you, and they know it works, and their outcomes are ultimately better.
Yeah, it's just really interesting, and we can see the number of devices that are being bought is massively growing across the board on it, and it feels like the education almost can't keep up with the demand for it. So Gareth, how do you see this particular initiative that you guys are working on? How do you see it planning out over the next few years?
So back when we started, our biggest obstacle was getting mentoring. You know, a lot of radiologists, GPs, physios that were doing it, yeah, they'd love to help, but getting the time to actually mentor was difficult, and that was our biggest obstacle for sure. We were having to fly over to England, fly some of the guys over to England for us. So that's part of what we want to offer as well. The fact that we've got a lot of us now doing a PG search for case accredited courses, we're trained, we're here to help. So we want to offer the mentoring as well. We want to encourage more practitioners, not just podiatrists like us, but physios, osteopaths, everyone, allied healthcare, get into it. Don't be put off by the training and the time, because it'll benefit you so much, but we want to be there to help support you through that with introductory courses, with follow-up courses. It's not a case of training and then you're out on your own. We want to be there to do your follow-on courses, your advanced scanning, try and help you through that, support you with the mentoring.
And I think
you're not on your own.
I think one of the special things that we bonded over is that we started the training at the same stage together. So we automatically had each other's backs and the phone call and the WhatsApps going, oh my gosh, I'm lost, what am I looking at, what's this case study, what's that? And I think if you're trying to do this course or ultrasound training as a sole practitioner with no support network, you're going to struggle. So we want to really create that community and that support network to try and push somebody through successfully.
But it is, because even with mentoring, we've all mentored people through their PG search in the last few years, and the first few months of ultrasound, you doubt yourself. You know, you've a 20-year experienced practitioner who is 3 months in thinking, what am I doing? I don't know my anatomy, I don't know anything, and you have this wobble, and it's so good that you're not there on your own. We want more people in all of Ireland doing this, so that you can pick up the phone and go, listen, do you feel like you know nothing as well? And you go, it's all right, it gets better.
But the whole void,
that's important.
There's a huge void for mentoring, and I think as we get together, and a lot of the courses, well, I know now the likes of Brunel and even the SMUG course, they won't allow people to register onto the course until they have a mentor, because I think that's where a lot of people take the course on and then struggle to get a mentorship. But you know, if we have this, we are all fully qualified, we're experienced, you know, we can offer mentorship to people, because we want to, I mean, we don't want to keep this to ourselves. We want people to go and elevate podiatry, elevate physio, you know, allied health. We want people to be doing this, but we're there to offer mentorship and to get into the course.
Yeah, if I'm honest, I definitely had and still have imposter syndrome sometimes, and like definitely I was scared going onto a course thinking, oh my gosh, what if someone finds out that I don't know what I'm talking about after 20 years? And you know, like I really do think that hopefully what we're going to have with MSK Ultrasound Ireland is that network where the questions aren't stupid, it's not embarrassing, you can reach out to us and you've got someone that has your back and has been through it. Do you know, I think I definitely had the fear.
Absolutely. And I mean, it's one of, every day is a school day. I often say that in ultrasound it is. And we're so lucky to have Dr. Alan Rankin, who was one of our mentors. And, you know, I'm actually looking forward to learning more stuff from Dr. Rankin as well, and from Marty. And I mean, I know we don't do upper limb stuff, but I'm actually looking forward to watching these guys scanning upper limb stuff and knees. We do scan knees, but I'd like to get a sportsman doc's opinion on you know, little tidbits. So I mean, there's so much stuff out there that we're going to benefit from as well in this group, and hopefully spread that on to the rest of the people who decide to come on board.
Certainly, but chatting to Andrew, one of the other physios on the team the other day, he was saying how much ultrasound has changed his practice as a physio with regards to shoulders. He thinks that has been a massive change for his clinic, because he's just able to fully assess shoulders, and where you think there's a tendinopathy, there's calcification. You're not wasting patients' time with rehab when you know that they need the shockwaves, they need their barbotage, whatever they need.
And I think that's the big selling point for starting the course, because that's how it's changed my clinic. You know, I say to people, we can offer you a targeted treatment plan, but know definitely what it is. Now, it might result that you still need an MRI, or you still need an injection, or you still need a consultant's opinion, but I haven't maybe wasted 6, 7, 8, 9 weeks, sometimes 3 months, you know, getting a device, getting orthotic, or trying other modalities. At least you pin down what the target is, and you've got a targeted treatment plan, no matter what your background is, whether it be medic or chiro or osteo or physio. We all have the same goal, you know, and I think patients are getting more expectant. They want the outcomes quicker, they're getting more impatient because they're having to pay, you know, a lot of NHS on its knees, and they want more bang for their buck, and they're not going to spend it.
And this course we're doing, it is an introduction, so we want people to come along. Doesn't matter whether you've had any experience or not in ultrasound. We're going to do some theory, but there's going to be so much hands-on practical. We're going to have people demonstrating, if it's a simple plantar fascia, to a first MPGA, to the more complex, maybe your syndesmosis, your ATFLs, things like that. You know, we're going to be there. We're going to allow people to lift the probe, to mess around with the knobology, and to actually scan.
Let's see if it's for them.
And with yourself, Andy, bringing the machines, it's going to be amazing. And it's not only that, as Claire says, you know, we're hoping to inspire people to go on the journey that we've done, because anyone can do it. You just need the time. and the commitment, and you can do it. But I think the practical aspect of it will be amazing to show people just what you can see, what you can do, and then we haven't even spoke about, you know, the benefits of ultrasound guided injections, you know, hyaluronic acid injections. You know, I mean, it's the list endless. What ultrasound opens doors to, you know.
But I definitely think this course as well is to let people come in and have a try, because you don't want to sign up to a 1-year PG cert and the cost of the machine if you've no idea what to expect. So we want people to come in who have never picked up an ultrasound before, have a go and decide, is this for me, is it not for me, can I pick it up, can I not pick it up, you know, just come and have a go and realise very quickly at the end of the day that you really will learn so much from having imaging in clinic in an MSK setting, of how beneficial it will be to you, to your patients.
Yeah, no, I mean, it's really, and I love hearing your energy, and it's great seeing it now, and I've heard it all day since I've been out here. And I think one of the things that I love from what we're doing is when you're getting people together, there's the clinical bit, but also it's the sharing of ideas, the energy, bouncing things off. You can get caught up in your own clinical world all the time, and getting you out of that into these environments, which are really positive, challenging, but supportive, I think is really important.
You know, from a personal point of view, one of the reasons why I did the ultrasound as well was for my longevity in the profession. Like, my hands are out, my neck's wrecked. You know, I had to diversify so that I was still working in 20 years' time. If I was staying in a routine podiatry practice, I would be off. I wouldn't be working.
Yeah. No, that's it. So tell me more about the event, Gareth.
Okay, so it is at the Mount in Belfast on the 22nd of August. It's a full day, 9 to 4 event. It is a lower limb introduction, so we're going to run through foot and ankle, knee, hip, cover hamstring, quads, everything really is a quick run through there. It's open to all allied healthcare and medics, so anyone who's working in an MSK caseload, very welcome to come in. And really try it out and see if it's for you. We've got physios, we've got podiatrists, we've got docs, sports med docs there, so there's someone for everyone to ask questions to and find out if going forward, you know, we want more people to be doing their PG cert, and you've got Brunel, you've got AECC in Bournemouth, you've got Smug, you've got Glasgow. So there's 4 top institutes now in the UK offering it. We want you to go and do that and improve your ultrasound, and we're here to help with mentoring and events through that as well.
And also give you an idea of, people think of PG cert, I could do that in the weekend. Was it one of the hardest courses you've ever done in your life? I mean, it was tough. So I mean, we're there, we've been through it, we've been through the trauma of it. I'm now bald since
you had an afro when we met. 6 months
but,
ago.
You know, we're there to tell people, you know, maybe take them through the journey, what they expect, you know, and we're here, we've all come through it, we've the experience, and hopefully if people are going to go on the journey, we can guide them and help them and mentor them through that.
And we have the small groups, we are keeping it small. It'll be a maximum of 4 per machine, and we've got the fantastic Alpinian machines there. Some, I think, a cart-based, portable, a bit of everything. So you're going to get to some really nice machines, see the image quality from those, and see if portable's for you, if cart-based is for you as well. But in small groups, you're getting to really practice on each other, seeing a lot of anatomy. Getting a lot of hands-on practice for the day, so really, really beneficial to anybody starting out on their PG search, maybe starting in September. This is for you. You know, get a few days or hours scanning before you start. If you're thinking of signing up in September, this is for you. Come and have a go before you sign up. Just get in, give it a go.
Brilliant. No, it sounds amazing. I'm really excited to be a part of it, and I think it's going to be the start of something really big. So well done for getting it this far, and looking forward to getting going in August.
Perfect, thank you.
Thanks for the support, Andy.
Yeah,
anyway.
absolutely.
Great,
Thank
super.
you.
Looking forward to it. Should be fun.
Cheers,
and of course, we're going to have some fun as well. It's not going to all be theory and stuff. There'll be a bit of fun.
Yeah, let's hope so. Brilliant. Thanks, guys.
No problems.